also known as a convulsion or fit, can be caused by raised body temperature linked to throat, ear, or other infections. It can occur because the brain is not mature enough to deal with the body's high temperature. When a child is having a seizure, you may find they have loss of or impaired response, vigorous shaking with clenched fists and an arched back, signs of a fever with hot, flushed skin and sweating, breath holding and red, puffy face, possible vomiting, or a loss of bowel or bladder control. If you think your child is having a seizure, place pillows or soft padding around the child so they don't injure themselves on surrounding objects. Do not restrain them. If they have a raised body temperature, try and cool the child by removing any bedding and clothing, although you may have to wait until the seizure stops to do this. Ensure there is fresh air, but make sure the child doesn't get too cold. When the seizure has stopped, open the airway and check their breathing. If they are breathing, put the child in the recovery position, call 999 or 112 for emergency help. While you wait for help, reassure the child and monitor their level of response. So remember, place padding around the child and don't restrain them. Try and cool them down. When the seizure has stopped, open their airway and check their breathing. If they are breathing, put them in the recovery position and call 999 or 112 for emergency help. And that's how you help a child having a seizure. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
If you know what to do, you'll give them the best chance of survival. If something has happened to your baby, you'll need to do a primary survey. This is a quick, orderly way for you to find out if your baby has any injuries or conditions that are life-threatening. You should always perform a primary survey before treating your baby because it will help you find out what's wrong and the best way to help them. We can use the initials DRABC or Dr. ABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. To perform a primary survey, first you need to ensure there's no danger. That means nothing near the baby that may cause further harm to them or to you. This is to avoid any injury to you and to prevent you from becoming a casualty as well. Look around quickly and make sure it's safe to approach. If you see any danger or anything hazardous nearby, clear it away quickly. Try to see if your baby responds to you by gently tapping or flicking the sole of their foot and call their name. They are unresponsive if they don't respond to you. Martha, can you hear me? Next, you will need to check if they are breathing. To check for normal breathing, open the airway. Place one hand on your baby's forehead and very gently tilt their head back. With one finger, gently lift the chin to open the airway and check to see if they're breathing. If your baby is not breathing normally, ask a helper to call 999 or 112 for emergency help. If you're on your own, use a mobile on speakerphone so that you can start CPR as soon as possible. If you don't have a speakerphone, begin CPR for 1 minute before making the call yourself. If your baby is breathing normally, check to see if they are bleeding. This will enable you to stop blood loss from the circulation. Try to treat and control any severe bleeding. If your baby is not bleeding severely, place your baby in the recovery position. Just cradle the baby towards you in your arms with their head tilted downwards. This will help keep your baby's airway clear and prevent them from inhaling any vomit. Keep monitoring their breathing until help arrives. If they stop breathing, open their airway and start CPR. So remember, do a primary survey to try and find out what's wrong as quickly as possible. We do this by checking for danger, check for a response, open their airway and check their breathing. If they aren't breathing, call for help, ask a helper to dial 999 or 112 for emergency help and begin CPR. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. If they are breathing normally, check their circulation, check for severe bleeding and treat if necessary. If there is no severe bleeding, hold them in the recovery position until help arrives. If they stop breathing, open their airway and begin CPR. And that's how you perform primary survey on a baby. Thanks for watching. Help support St John Ambulance. People may faint as a reaction to pain, exhaustion, hunger or emotional stress. It may also happen after someone has been standing or sitting still for a long period of time, especially if they are hot. When someone faints, their pulse slows right down, but it usually picks up again quickly and goes back to normal. If someone has fainted but doesn't come round after a couple of minutes, then this could be more serious. There are 3 key signs of someone who has fainted. They have a brief period of unresponsiveness, causing them to fall to the ground. They may have a slow pulse. Their skin may be pale, cold and sweaty. If someone's feeling faint, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulder or a chair if available, to help blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask bystanders to move away, and if you're inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again, quickly open their airway, check their breathing, and prepare to treat someone who is unresponsive. So remember, if someone's feeling faint, lie them down and raise their legs. Make sure they have plenty of fresh air, and when they recover and are feeling better, help them to sit up slowly. If they remain unresponsive, prepare to treat an unresponsive casualty. And that's how we help someone who's feeling faint or have fainted. If this video has been helpful to you, help support St John Ambulance by going to sjaa.org.uk/donate.
Fingers and hands can easily get stuck in small spaces. Sometimes they may get hand or finger injuries such as bruises, cuts or fractures, or they may hurt or sprain their arm or wrist. In the following steps we'll cover hand and finger injuries, then we'll cover forearm and wrist injuries. If your baby has trapped their hands or fingers, these are the things to look for. They may find it hard to move their hand or wrist. They may feel pain in the area. The hand or wrist may be tender and there may be swelling or bruising. If you think your baby has a hand or finger injury, take the following steps. Sit or lie your baby down and try to raise and support the affected wrist and hand. If there is any bleeding, run the cut under cold water first, then loosely cover the wound with a new sterile dressing or large, clean, non-fluffy pad. Call your doctor or see a nurse, especially if your baby's fingernail has been injured or you think there may be a fracture, a broken bone. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. Now we're going to move on to wrist and forearm injuries. If your baby has injured their wrist or forearm, these are the things to look for. The area may be tender and there may be swelling or bruising, and they may feel pain in the area. It can be difficult to know if your baby has a sprain or a fracture, but if you think your baby has a wrist or forearm injury, take the following steps. Remember, RICE. Rest. Help your baby to sit or lie down and support their arm in a comfortable raised position. Ice. Apply something as cold as your baby can bear. This could be a cold flannel, an ice pack or frozen peas wrapped in a cloth. Leave the ice pack in place for no longer than 10 minutes. Comfortable support. You could wrap a soft layer of padding like cotton wool around the area. And elevation. Keep your baby's arm raised with something soft like cushions or a rolled up blanket. Call your doctor or see a nurse if your baby is in severe pain or they can't use their hand or wrist at all. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. So remember, for hand or finger injuries, sit or lie your baby down and raise the injured hand. Wash any cuts and cover the wound with a non-fluffy dressing. Pad the hand with something soft. Call your doctor if you have any concerns. For severe pain, you could give the recommended dose of paracetamol. For wrist and forearm injuries, remember RICE. Sit or lie your baby down and raise the injured arm. Apply ice. Support the arm and keep the arm raised. Again, call your doctors if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. And that's how you treat a baby who has hurt their hands or their arms. Thanks for watching. Help support St John Ambulance. Donate.
If you think someone has had a head injury, there are 6 key things you may find. They may have become unresponsive, even if for a short time. There may be a scalp wound. They may complain of dizziness or nausea. They may have memory loss of events at the time of the injury or before the injury occurred. They may complain of a headache. They may be confused. If you're worried about someone who has had a head injury, you should get medical advice. With someone who has had a severe head injury, you may find that they have had a severe blow to the head, unresponsiveness or a deteriorating level of response, leakage of blood or watery fluid from the ear or nose, unequal pupil size. If a casualty has any of the signs of a severe head injury, seek emergency medical help. To treat someone with a minor head injury, sit them down and give them something cold to hold against the injury, like an ice pack or frozen vegetables wrapped in a cloth. Amy, can you just put the injury? Thank you so much. Assess the level of response using the AVPU scale. Ask yourself, A, is the casualty alert? Are the eyes open? Do they respond appropriately to commands? V, does the casualty respond to your voice? Can she answer simple questions? P, does the casualty only respond to pain if you pinch the earlobe? Do they open their eyes? U, are they unresponsive to any of the above? If they can respond normally, the head injury is probably minor. Keep monitoring their level of response, breathing, and watch for any changes. Treat any scalp wounds like a bleed by applying direct pressure to the wound. When the casualty has recovered, ask a responsible person to monitor and look after them. If a casualty has sustained an injury to the head whilst playing sports, do not allow them to return to the sport until they have been fully assessed by a medical practitioner. Advise them to seek medical advice if their condition gets worse, they're over 65, they've had previous brain surgery, they're taking anti-clotting medication, they've been drinking or taking drugs, or if there's no responsible person to look after them. If you check their level of response and they're not alert, and so you think that they've had a severe head injury, call 999 or 112 for emergency help and tell them that you suspect a head injury. If you can, use a speakerphone so that you can continue to treat the casualty whilst making the call for help. If they're unresponsive but breathing normally, following a head injury, open the airway in the position that they were found, just in case they have sustained a spinal injury as well. This is to reduce further movements to the neck. Call 999 or 112 for emergency help. Continue to monitor the levels of response while waiting for help to arrive. If you think someone with a minor head injury is getting worse, they may show these signs: increased drowsiness, persistent headache, confusion, dizziness, difficulty walking, difficulty speaking, vomiting, double vision, seizures. If you're concerned, call 999 or 112 for emergency help and monitor their level of response. So remember, when treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
Headaches are not usually serious and can be treated at home. Common causes include tiredness, stress, an illness such as flu, or exposure to hot or cold temperatures. But headaches can be a sign of a more serious problem, like meningitis, head injury, or stroke. If someone has other symptoms, or it's following a blow to the head, be sure to seek medical advice. If someone has a headache, help them to lie or sit down in a quiet place and give them something cold to hold against their head. This could be a cold compress, it could be an ice pack, or a bag of frozen peas wrapped up in a cloth. Be sure not to leave it on for longer than 10 minutes. For adults, you can suggest they take the recommended dose of painkillers such as paracetamol. For children, you can give them the recommended dose of paracetamol syrup. If someone has other symptoms such as fever, vomiting, a stiff neck and sensitivity to light, be sure to seek medical advice immediately. Or if they become unresponsive, call 999 or 112 for emergency help and prepare to treat an unresponsive casualty. If they have a headache following a head injury, if the headache is not settling or their condition is getting worse, they should also seek medical advice immediately. Remember, get them to lie or sit in a quiet place. Help them to take the recommended dose of painkiller. And if you are concerned, seek medical advice. That's how we treat a headache.
A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs. Pain in the chest, which could spread to the jaw, neck, or arms. Breathlessness. Discomfort in the stomach similar to severe indigestion. Collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack. After you've made the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 mg, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. Try to stay calm to avoid unnecessary stress. If they become unresponsive at any time, open the airway, check their breathing, and prepare to treat an unresponsive casualty. You may need to do CPR. So remember, if you think someone is having a heart attack, call 999 or 112 immediately, help move them into a comfortable position, and encourage them to rest. Give them 300 mg of aspirin to chew and help them with their angina medication if they have some. While you wait for help, keep checking their breathing, pulse, and level of response. And that's how we help someone who may be having a heart attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/.
To bandage somebody's hand, use a roller bandage. Place the bandage on the inside of the wrist, just below the thumb. Wrap the bandage straight around the wrist twice. Then wrap the bandage from the inside of their wrist diagonally across the back of their hand up to the nail of their little finger, straight across underneath the fingers and diagonally back across the back of their hand to the outside of their wrist. Pass the bandage under their wrist and repeat